Welcome to the program, Dr. Ramsey.
Thank you so much, Alicia, for having me today.
So, this month of November is known as Diabetes Month. Could you tell us about that team?
So, Alicia, globally, the team is Know Your Risk, Know Your Response. And actually, during the years of 2021 to 2023, the sub team is Access to Care. So, basically, what we're trying to reach out there to the persons, to the population, is getting persons to access the care that exists. In Guyana here, we have at least 350 health facilities. We have our regional hospitals as well. And we want persons to be able to access this care because they can be able to get tests done, such as our HbA1c testing or random blood sugars testing. And they can also access medical attention through seeing physicians as well. So we really want to uh, open our facilities, let them know that they are there, that they can have access. So that is basically the idea behind this team, not globally, but just for us as well here in Guyana.
Definitely. And we have a culture where persons usually wait until there's an issue to actually visit their health centers and visit their hospitals and so on. And so it's important that we encourage persons to get checked, get screened. Don't wait for issue or a health condition to arrive, but definitely get checked and screened.
Exactly. We really want them to break the stigma. We want them to know that we're there. They're doctors, nurses, they're everyone there waiting to be able to deliver this care to them. We just need them to access it.
Definitely. I know that the Ministry of Health has been doing a lot of work in the aspect, especially of diabetes, and we know that this is a global issue. Could you tell us what strategies has the ministry adopted to better combat this health condition and monitor it across the regions?
So, here at the Ministry of Health, we've been having outreaches. These outreaches are training outreaches as well. We've been able to go into the regions, diabetes and their risk factors, such as tobacco, nutrition. We've been able to train our health workers, and these are workers in the primary healthcare, because we feel that prevention is the best cure, and we need our primary healthcare workers to be able to talk with patients, let them know what their risk factors are, let them know that there is a way, this way is through counseling, that they can be able to not just come pick up medications and that is it, that they can be able to know certain small daily routines that they can be able to include in their daily lifestyles to help to improve their chances of living with diabetes, because persons lead very normal life, Alicia. Diabetes, you can have either type 1, type 2, but you're able to live a normal life. You're able to get the care and the attention that you need. Our government spends a lot of money into our health system, and we want persons to know that they can be able to access care. So the trainings do have this ability to have our healthcare workers utilize the information that is already available, that's already out there. It's been used globally, so that they can be able to teach patients, at least if it's two things they tell their patients when they come to their health facilities. It makes a lot of increased steps in a person's life living with diabetes or any chronic illness.
Definitely. When you guys do these outreaches, what is the response like from patients and persons who visit the site?
So the response is huge. There's a lot of gratitude. A lot of persons in the far-reached areas or regions, sometimes they don't have the access to, this is transportation-wise, to reach to some of the health facilities. So when we go and we're able to be there, interact with them, the gratitude is there. They take it, they listen, they try to implement changes when we're following up through the RHOs and so on. So it's overwhelming. It's good.
Awesome. Could we talk a little bit about some of the activities that you guys have planned for this entire month?
Okay, so for Diabetes Awareness Month, we're having our Observance Day, which, as you said earlier, it's on the 14th. So what we're planning to do is not, our reach is always to decentralize. So we're having this observance at our Diabetes Comprehensive Care Center, where persons will be able to be a part or be able to access this community health fair basically that we will have. We will have a range of services that are related to the complications of diabetes, such as eye testing, they'll have foot screening, they'll also have HbA1c and RBS testing available there. And we have also collaborated with some of our private investors because it's very important for the public to know that, there are private investors there that are willing and capable to invest as well to ensure that persons have a healthier life. So this is one of the activity. There is also going to be a pop-up screening event, which is going to take place with our mobile unit that we have right here at the Ministry of Health. The idea is to go into 4 of the market areas so that we know persons are busy. Sometimes this is the problem we have with persons accessing that care.
Yes.
So why not give the care to them? And that's what we are all about at Ministry, about bringing that care to the patient,
yes.
to the population. So with our pop-up screening event, which the dates and the places will be announced later, they will be able to have that access as well. Also, what is knowing about chronic diseases if we're not going to have continuous education done? So we do have a series of CMEs lined up so that persons and the healthcare system, this is for doctors, nurses, can be able to benefit from knowing
Yes.
the updated, evidence-based medicine that there is out there that we're using too. So those are just some of them.
It's quite a packed schedule.
Yes.
I want to commend you guys for the work that you guys have been doing at the Chronic Disease Unit. We're going to go into a break and be right back with more on World Diabetes Day.
I was 53 years old when I was diagnosed diabetes. There was some sickness in which I can't remember, but I went to Marconi Hospital and the doctor diagnosed me as diabetic. Well, my understanding from that is that it's a disease that occurred when your blood sugar is too high often and you don't eat the right food as being prescribed. But at first I was never direct on what I should eat and not. It's until I start coming here then I get to understand the full impact of the type of food I should have been eating and not to be eating. Well, I never used to pass anything. I used to eat anything. Wild meat, red meat, white meat, you name it. Well, I've got the changes when I start coming here and the dietitian direct me that I should be only using steamed food and such like. Mostly proteins too. Well, with a stubbornness you've got to adapt if you want to live long too. I've got to be stubborn, and then at the same time you've got to get the finance in place to be of an assisting part. Well, I exercise a lot, so to speak. I purchased 2 machines, a bike and those range machine that you pull the weights, exercise your legs and such like. It changes me, yeah. In my eating habits, my walking habits and such like. Because what happened, I'm a live entertainer with these one-man bands. And a couple of times, ambulance had to come for me too. Because the symptoms I would be getting is like, the dizziness would step in, and the weakness and vomiting would come at the same time, then I would fall. But after then I start singing by sitting down, so it doesn't occur anymore. In accordance to using the medication and my food intake, I've got to be stubborn too in order to go ahead, because in my home there are different foods I cook. And when you get a smell, you might need to go back there. But because of the stubbornness and you need to go as prescribed, you have to go your way in order to do things right. To be truthful, I've started coming here from the 23rd of June this year. And these are my medical family, very close. When I doesn't come here, I feel like if I miss something, even though it's getting better and I've been told to come twice a week. But when I doesn't come here, like I miss something, and they're very, very nice. Even though you leave home vexed and you come here, you've got a smile. I was thinking about, seeing that we have the resources, their diabetes could be given a stipend to assist in their transportation, because sometimes Many of us don't have the transportation to move to and fro, and assist in certain medication that they doesn't have, that they might prescribe you to purchase. And in the changing of your diet too, it can be assisted. And with this illness, you cannot eat rice 3 times a day. Or even though you eat rice 3 times a day, it's going to be a small amount. And if you're a large intaker, it's going to take some effect on you because you wouldn't feel that full. You see, other than my band work, I've been assisted to my sister from abroad. So I can go to the seaboard and buy fish, clean it and keep it in the fridge. I can buy a lot of vegetables to be steamed and such like.
Welcome back to the program. For those persons who've just tuned in, today we're talking about diabetes prevention. And I'm here with Dr. Ram Singh. Dr. Ram Singh, could you tell us a little bit more about what diabetes is for persons who still don't have an understanding of what it is, the causes, and so on? Tell us about that.
Okay, so basically, diabetes is a chronic illness. When we say chronic illness, we're saying that it's a long-lasting illness, means it's not going to go anywhere. Once you have it, you have it. Just briefly, when someone says they're diagnosed with diabetes or they have diabetes, what happens is that the body, there is a hormone called insulin, and insulin is the one that regulates this blood sugar in our body. So when we're diagnosed with diabetes, it's the fact that our bodies isn't one producing enough of this insulin to break down those blood sugars, or the insulin is there, but the body isn't able to effectively use it. So then is when this happens, we have all these ranges of symptoms because, Alicia, what happens with this blood sugar there in your body? It's just there, so it needs to get out. So what happens, it puts our kidneys now into this overwork drive to get this glucose out of your system. And hence you might find that a lot of the persons with diabetes, they complain of having to use the washroom frequently because there's frequent urination. There is also an increase in hunger. There is also persons that would find themselves having a rapid weight loss. So these are just some of the things or some of the symptoms that we can be able to look out when it comes to diabetes. I know there is also persons that complain that, oh, I'm drinking a lot of water, I'm very thirsty. For children, we need to pinpoint too. Parents can look out that there is sometimes a sudden bedwetting pattern with them. So we want persons to be aware of these. I know a lot of times persons don't zoom in or focus on these symptoms. So it's just for persons to at least listen and they can know what to look out for.
Definitely. What are some of the risk factors for diabetes? Because I know of persons who would have had family members with diabetes, and in latest days and stages, they would have been diagnosed with diabetes as well. So tell us about some of those risk factors that we can look for.
So definitely, family history is something very strong. Your chances of developing diabetes based on your family history, your genes, that is one of the highest area that we look at. As you know, in Guyana here, we have probably approximately 65,000 diabetics. So that would tell us already that maybe the persons, these are for the smaller adolescent portion or sometimes the children in themselves, the kind of far-fetched reaching figures that we're dealing with here in Guyana. So definitely that's one of our biggest risk factor. Obesity, Alicia. Obesity is by far one of the most troubling, not just here in Guyana, but globally. So we're looking at obesity, the fact that there is physical inactivity being done. A lot of persons have a very sedentary lifestyle. So risk factors such as these, a lot of persons don't realize alcohol use and also tobacco use. Now, when persons hear tobacco use, they're wondering, how come smoking is making me turn a diabetic? But what they don't know is that the nicotine, that chemical in those cigarettes, are usually altering our cells, preventing us from absorbing that glucose. It brings me back to what diabetes is again. Right? So imagine your cells not able to take in this glucose now, to produce that energy in your body just because you're smoking. And we're really trying to battle these risk factors, but also nutrition plays a very big part, what you eat on a daily basis. So these are some of the main risk factors that we have, and we're trying to work around with too. So you can only imagine.
Yes, I'm so happy that you would have highlighted those. Could you tell us the difference between type 1 diabetes and type 2?
Oh, definitely. So basically, in our type 1 diabetes, our patients, now they have no insulin, or sometimes they have a very little amount of insulin. So that's why a lot of time you'd find our type 1 diabetes patients are on insulin usage. Basically, type 1 means that they're insulin dependent. So they need that extra shot of insulin to help kickstart those cells to take those glucose so that they can get energy. Now in type 2, your body has that insulin, but it's not effectively being used. So that is the main difference. That's why you may see, or probably you might hear, at least your persons are like, oh, I'm on metformin, I'm on Daniel. Those are type 2 patients. And a lot of the times, our type 1 patients are younger person. It's our younger population, mostly under the age of 30.
So is it possible for a patient to move from type 1 to type 2?
So no, there is no type 1 moving to type 2. However, Alicia, there is a pre-diabetes moving to type 2. And that's another form as well. Of recent, we've been promoting pre-diabetes. And this is where screening comes into play. Because this is the reason our goal is about access to care. So pre-diabetes, you're not diagnosed as a diabetic as yet. You do have high blood sugars, but it's not as high as a type 2 diabetes personnel. So this is where screening plays a big part, having persons from ages 25 years and older. If you have a BMI, this is a body mass index that's more than 25, it's 30 and over, then you definitely need to get screened to see what's going on with your blood sugars. So these are just some of the things that I can be able to tell you, but prediabetes is also something we're looking at.
Thank you, Dr. Ramsing. Could we talk a little bit about lifestyle changes? I know once persons are diagnosed with diabetes, then there's a lot of changes that needs to take place. But not only for persons diagnosed, but also for persons who are trying to prevent diabetes from, taking over their bodies and so on. What changes are necessary? What can persons do to ensure that they stay healthy, active, and, strong?
So when it comes to our lifestyle changes, firstly, we have to ensure that the population want to have lifestyle changes. At least if we don't
it begins with the individual.
Exactly. Because if you don't want to have an improved life, then you're not going to make any of the changes. And basically, if persons are listening carefully to this program, they're going to look at the risk factors. Now, in the month of September, we would have started basically campaigning with diabetes. We had our Go for 6 goals. In these Go for 6 goals, there we had preventative measures. We want persons to have a healthier diet. We want them to be able to make healthier choices. We want persons to access their healthcare system, make sure they're keeping up with regular checks, ensure that they're drinking or having their medications, quitting smoking, quitting alcohol. These are some of the things that are going to ensure that we can be able to not only prevent diabetes, but so much more of the other chronic illnesses. We also want persons to know that if they find that they are not feeling well, that they can be able to go to a health center or a medical care center. When we talk about exercise, we want persons to also know that physical activity, it's not walking from one point to another. It's at least giving that input of 30 minutes a day. For kids, we recommend 60 minutes because they're a lot more active. But for the adults, we want them. And if you can't do the walking, then develop a hobby. There's gardening, there's riding, there's swimming, sometimes even at home, Alicia. A lot of times, and we're guilty of it, sometimes we put the remote right next to us when we're sitting down so that we don't have to walk to get it. But I encourage persons to put your remote, put your cell phone somewhere far. It will encourage you to take those extra steps.
Yes.
Because if we're going to increase our physical activity, we're going to prevent having our sedentary lifestyle. Being sedentary can lead to obesity as well because you're not being active.
Yes.
So basically, all of these prevention tactics or remedies that we have, they're linked to one another. So once you have the mindset to start, you're going to see results.
Thank you, Dr. Ramsing. We're going to go into another break and be right back.
I'm a diabetic 30 years now. Years back, I was in town and I was feeling a little dizzy. And I went into Medicare and asked them to do a sugar test. And my sugar was 600 and something. It was very high. They give me insulin and they tell me to lie down and wait. And I tell them no, I need to get home. So I went home. And from then onwards, I start using my tablets, insulin and metformin, and start trying to do the right thing. Diabetes is when your pancreas ain't working, it produces no kind of insulin, so you gotta use metformin, insulin, and try to eat a lot of greens, steamed greens and so on. So you can get you just get like kind of cold sweat when you're sugar low. You kind of see a little dizzy. I made a lot of changes in terms of eating, exercising, my breakfast, lunch, and dinner. I changed up a lot with it. I stopped eating meat, most fish, eggs, and these kind of things you use. But diabetic life is a little tough life to live in terms of spending the money to buy the things then, especially when you're not working. Alright, to start with eating, the food a bit expensive right now, right? So you really can't eat the way you're supposed to eat, but you will try to. You wouldn't get as much as you could, right? In terms of exercise, well, exercise, you could exercise anyway. You could exercise in bed, you could exercise on a chair, wherever kind of exercise you feel like doing, you can do. So I wouldn't go much on the eating part because of the spending of the money to buy the things then. I might be able to buy the things that I need, but you might be able to do it. Right? So I wouldn't go on that, I would push to one side. But the exercise, you can exercise on bed, you can exercise in a chair. You don't have to direct go out on the road and run and, you can exercise at home. Do any kind of exercise, free hand exercise, foot, back, neck, any kind of exercise you can sit on. Diabetic sick is not an easy sick. It's not an easy sick.
Welcome back to the program. So before we wrap up the program today, Dr. Ramsingh, we would like to talk a little bit about prevention. How can we prevent diabetes?
So prevention, Alicia, let's keep to the key facts. Prevention is all about our lifestyle changes. So let's try to be able to do more exercises.
Yes.
Let's eat right, because if we're not eating right, then we aren't doing anything at all. And with our physical activity, let's try to encourage persons to at least have 30 minutes a day to be able to be physically active. Let's try to prevent obesity, because these are the main things that make diabetes such a big global monster of a disease.
Indeed, and the next thing too that we have to definitely touch on is the importance of early screening.
Of course, early screening is a must. Just like the Team for Our Diabetes Awareness Month, we want persons to access care. If you know, or if anyone out there, if you know that you have a body mass index of more than 30, you know that you're 25 years and older, come on, let's get screened. You can access any one of our health facilities, any one of our health centers, and you can be able to talk to a physician, talk to a nurse, and they can be able to guide you, because we want to know our risks so that we can know your response.
Just before we close today's program, could you tell us a little bit about services that are available for persons with diabetes?
So there are services, there are the ophthalmology services. This is for eye screening. We also have diabetic foot care services. We have in at least 6 regions, Region 2, Region 3, Region 4, Region 5, and Region 6 and 10. They have diabetic foot care centers that you can be able to go. As persons with diabetes, you may end up having a wound to your feet. So don't let that avoid you from accessing care. Early detection will definitely prevent any complications, and that's what we're trying to do.
Thank you, Dr. Ramsingh. Thank you for joining me on the program
Thank
today.
you for always having me, Alicia.
And I want to encourage you and your department to keep up the good work that you guys have been doing.
Thank you so much.